I'm Dr. Jason Lee, sports medicine physician at Hudson Physicians. I'm going to talk to you first about the Lipogems, or the microfragmented adipose tissue procedure that can be done to help with aches and pains of the shoulders, elbows, hips, knees, etc. All this procedure works. It's a clinic-based procedure. We have you either lie on your back or your stomach, and what we have to do is extract some of your fat stem cells from your abdominal cavity. We basically extract some of your fat from your abdominal region, and what we do is we go and take out the best part of that, where we kind of clean it up.
So right now the fat is in the device, it's sterile and it's secure. We're running normal saline through the device, through the tubing. It's a one-way system. Basically right at this point in time we're just washing the fat. We haven't started breaking it up yet. So once I get a good first washing, I basically lock the device and then we shake for 30 seconds. There's 2 shakes. First one, each one 30 seconds. After you're done shaking, I just open the device back up. Fluid floating through the device. You can start seeing it get clearer. So it went from sort of bloody looking, now it's more of a pinkish. So what the device is doing is it has blades at the top and the bottom of the device with balls in the side. Basically it's taking the adipose or the fat tissue, shearing the fat and breaking it up into adipocytes. Adipocytes are the cells that we want that are going to initiate repair. In this case, in our patient's hip is the target. Once we get a good, clear look to it,
once you get the finished product from the procedure, you turn on and inject it with the ultrasound into the correct spot. We're going to start with the numbing medication piece here. A little poke here. And there's comfort or pain with this at all?
Just a little bit of a pinch.
Numbing the tract, or we'll be doing the injection part. So. Done with that. Okay, now we'll be coming in for the actual injection or procedure. So a little poke here. Get a little pinchy as we get close to the hip here. A little tap on the bone there a little bit. Take a picture there, Tara. Now we're injecting. So you can see the Lipogems is going in nice and smoothly there into the hip joint. How are you doing with this?
Just feel a little pinch once in a while. Get a little stronger.
And then we're done. Onto the platelet-rich plasma injection. So that's another procedure that's done here. It's an orthobiologic or regenerative medicine procedure that can be used to treat some similar conditions of shoulders, elbows, knees, etc. How that process works is we actually take your own blood, typically out of your arm. Once we get out the blood product that we want, then we take the blood product, we put it in a centrifuge. Then we have the centrifuge spin the blood product around to get the blood product that we want to inject into your abnormal area, which is called platelet-rich plasma. Once we get that blood product, then we inject it into the area of abnormality.
Dr. Lincoln Lickness from Hudson Physicians. We're treating Jason Lee today. He's got some arthritis of his thumb joint. We're using platelet-rich plasma inside the joint, try to regenerate and heal up some of this inflammation in the tissue. So I'm gonna just go ahead and I have it under ultrasound. I have the joint lined up. It's gonna sting him a second here. So 1, 2, 3, Dr. Lee. There you go. And I'm a little to the side here, so I got to angle over. Some more. And that should do it. You okay? Still?
Yes.
Feeling all right? All right. And okay, here we go. Right into the joint, fills up the capsule, and we are out of there. Okay, that's it. It's as simple as that. So now we're going to do Dr. Lee's PRP injection to his plantar fascia that's been bothering him a long time. He's tried a bunch of other conservative measures and they've kind of failed. So now we're going to go ahead and treat him with the PRP. So I'm going to give him a little bit of numbing. This area is sensitive in the foot. So I'm going to help him out a little bit here. So his big sting here, 1, 2, 3. Hang in there, hang in there, hang in there. And okay, that'll help for now. I'll take the edge off while we do the real procedure here in a second. Okay, here we go. So when I inject, I kind of pepper it. You doing okay?
Mm-hmm.
All right. Well, you're tough. And you are done. Okay. Save that one. All right. Yep. That's it.
So I've just recently undergone a platelet-rich plasma injection into my thumb and into my left foot. So my personal experience from this is it's no different than any other injection that can be offered in the clinic. As far as a corticosteroid injection, viscosupplementation, which is lubricating injection, etc. There's some mild discomfort with the poking into the area that needs to be injected, so there is some mild pain that goes with it, but nothing that is over the top that can be managed with typical over-the-counter pain medications to help with symptoms, etc.